over 400 health workers to be sent to Sarawak next week. Hello and good afternoon. I'm Mohana Priya. Welcome to Updates at Noon. A total of 430 Health Ministry personnel will be sent to Sarawak on 21st April to assist in efforts to contain the spread of COVID-19 in the state. Its Minister, Datuk Sri Dr. Adham Baba, said the decision to increase the number of health personnel in Sarawak followed his visit to the state last Monday and Tuesday, during which he also visited the COVID-19 Quarantine and Treatment Centre at Stadium Perpaduan in Kuching. On Wednesday, Sarawak recorded 489 new COVID-19 cases, with the Tembok Sri Aman and Jalan Puncak Borneo clusters being the main source of the positive cases. Datuk Sri Dr. Adham said Sarawak needed about 1,436 health workers, including medical officers, assistant medical officers, microbiological science officers, nurses and drivers.
Petugas-petugas yang telah pun kita hantar merupakan petugas yang telah pun divaksinate 2 kali completed dose.
According to the Health Minister, almost 600,000 frontline workers have received the first dose of COVID-19 vaccine and almost 470,000 of them have completed both doses. On the distribution of cases in Sarawak for the period between 1st April until Wednesday, he said the Meradong district recorded the highest number at 771, followed by Julau 605, Bintulu 556, Kapit 387, Beluru 343 and Sibu 283. On the use of the AstraZeneca vaccine, Datuk Sri Dr. Adham said the decision would be announced after the Special Committee on COVID-19 Vaccine Supply Access Guarantee meeting next week. The Sarawak government has requested the federal government to supply the state with China's single-dose CanSino COVID-19 vaccine. Its Deputy Chief Minister, Dato' Amar Douglas Ukah Umbas, who is also State Disaster Management Committee Chairman, said he had made the request during a meeting with National COVID-19 Immunisation Programme Coordinating Minister Khairi Jamaluddin at Putrajaya recently. Dato' Uga said the CanSino vaccine, which only requires a single-dose shot, was the most feasible vaccine for Sarawakians living in the interiors.
So we have requested for at least 800 to 600,000 of CanSino to be supplied to Sarawak, and that will facilitate our vaccination of people in the interior supaya kita tidak pergi sana 2 kali.
On 1st April, Health Minister Datuk Sri Dr. Adham Baba said Malaysia will receive 3.5 million doses of the CanSino COVID-19 vaccine from China in stages beginning this month. He said the CanSino vaccine would be used mainly in rural areas and where it was difficult for recipients to receive 2 doses, as required for other vaccines, such as the ones from Pfizer, BioNTech and Sinovac. Meanwhile, Dato' Uga said the state government was taking all the necessary measures to ensure that Sarawak secured the vaccines required for its immunization program. He added that this includes the state government's preparedness to buy their own vaccines so that the target to conclude vaccinations in Sarawak by the end of August can be achieved. The Ministry of Federal Territories, KWP, will shut down Ramadan bazaars under its supervision if they are hit by COVID-19 infections. As such, its Minister Tan Sri Anwar Musa reminded all parties, especially Ramadan bazaar organisers in the Federal Territories, to improve on the stipulated standard operating procedures to contain the COVID-19 pandemic. Elaborating further on the matter, Tan Sri Anwar said it is mandatory to comply with the SOPs imposed, especially in terms of the number of visitors, but apparently it was not controlled to the point that physical distancing exercise was not keeping with what was set. He also said among the SOPs which must be improved on and complied with was that the organisers could only have a single entry and a single exit at a Ramadan bazaar. The ministry added that the government wants to allow the bazaars to open until the end of Ramadan, But a bazaar will be shut down if a COVID-19 outbreak takes place due to SOPs not being complied with. On the hike in COVID-19 cases, Tan Sri Anwar urged all community heads in housing areas to remind the people to comply with the SOPs, including reducing activity outside the house if there was no pressing need. In addition, he said that all parties must play their roles to curb the spread of the pandemic. And in a related development, a Housing and Local Government Minister, Datuk Zuraida Kamaruddin, said activities in Ramadan bazaars will be more orderly and better organised, with stricter compliance to standard operating procedures in 5 or 6 days, with the involvement of local authority enforcement. Datuk Zuraida admitted there were viral pictures of SOP non-compliance at Ramadan bazaars, especially on physical distancing. She, however, said that with enforcement at local authority level, there will be more effective control. She also called on MPKL to actively encourage the residents in Kuala Langat to register for COVID-19 vaccination. Meanwhile, in Putrajaya, a Housing and Local Government Ministry statement said SOP enforcement by local authorities would be carried out at all Ramadan and Aidil Fitri bazaars throughout Ramadan, including bazaars which are not under the control of local authorities. Effective Wednesday, the Health Ministry has delegated authority to mayors, local authority presidents and Grade 19 enforcement officers to compound violations under the Prevention and Control of Infectious Diseases Act 1988, Act 342, including non-compliance of SOP at Ramadan bazaars. In this regard, KPKT said at least 4 enforcement officers would be on duty, depending on the size of the Ramadan bazaar. Controls at the entry and exit of Ramadan bazaars as well as patrol would also be assisted by members of the People's Volunteer Corps RELA for crowd management and SOP compliance. KPKT said there would also be inspection on traders covering typhoid jab, food handler card, permit payment, SOP compliance and stall cleanliness. There were 2 more cases of UK B117 variant found in the country, bringing the total number of cases for the variant to 5 as of yesterday. Health Director General Tan Sri Dr. Nur Hisham Abdullah said the 2 new cases were locals with history of travelling to Poland in March 2021 before they were found positive on 30th March and have been given further treatment. According to Tan Sri Dr. Nur Hisham, phylogenetic analysis showed the 4th case was infected with UK B117 variant, which have significant similarities with the variant from Poland and have high probability of the case being infected when the individual was in the country. However, he said the source of infection for the 5th case could not be determined, as analysis showed differences in the variant which infected the case. He said these findings of the 2 cases also showed that the 2 cases were infected from different sources. In this regard, the Health DG reminded that the UK B117 and South African B1351 variants detected in Malaysia could easily spread fast, even though many scientific research is still going on to study the symptoms and infection effects of the variants. At the same time, he advised the people to practice good hygiene, such as frequent washing of hands, wearing face masks in public places, and observing physical distancing at all time. He said MOH, through the Institute of Medical Research, IMR, and the National Crisis Preparedness and Response Centre, CPRC, is monitoring the development of mutation in the country, which would be announced from time to time. Meanwhile, Tan Sri Dr. Nur Hisham said 15 new COVID-19 clusters were identified yesterday, 9 of which detected in the workplace and another 6 in the community. The workplace clusters were Kampung Bunut Sarang Burong, Kampung Domis, Kampung Labok and Kok Lanas in Kelantan, Jaya Setia and Perabot Olak Limpit Selangor, Lorong Megah Jaya and Jalan Labok 3 Sabah and Jalan Radin in Kuala Lumpur. The clusters detected in the community involved Biaskim and Malangkap Tomis in Sabah, Kampung Becah Semak in Kelantan, Jalan Cempaka Putih in Johor, Taman Rakyat Terengganu and Kampung Pokok Macang in Kedah. The number of new COVID-19 cases in Malaysia also surpassed the 2,000 mark, with 2,148 cases reported yesterday. The last time the country recorded over 2,000 cases was on 5th March, with 2,154 cases. Beginning today, those facing up to 3 years imprisonment may qualify for community service, according to the Emergency Offenders Compulsory Attendance Ordinance 2021. Previously, only those facing up to 3 months imprisonment were eligible for community service. The ordinance introduces amendment to Section 5 of the Offenders Compulsory Attendance Act 1954, which states that the court may, instead of such a sentence or committal, make a compulsory attendance order requiring a person to attend daily at a centre where they will undertake compulsory work for a period not exceeding 12 months and for such number of hours each day not exceeding 4, as may be specified in such order. The court shall also consider the character of such person, the nature and seriousness of the offence, and all other relevant circumstances. Meanwhile, according to Section 5A of the same Act, it is stated that the Director General may, in writing, give a direction to transfer any offender who is required under the compulsory attendance order to attend daily at a centre to another centre upon an application made by the offender, or if the Director General thinks it is necessary to do so. The ordinance was gazetted when the Yang di-Pertuan Agong Al-Sultan Abdullah Riayatuddin Al-Mustafa Billah Shah was satisfied that immediate action was required to guarantee and preserve the security, economic life and public order. On 12th January, the Istana Negara, in a statement, announced that the Yang di-Pertuan Agong consented to the proclamation of emergency to be implemented nationwide until 1st August as a proactive measure to curb the spread of COVID-19 in the country. The Malaysian Communications and Multimedia Commission, MCMC, is finalising the tender process for satellite broadband access services in 839 remote locations nationwide. Communications and Multimedia Minister Datuk Saifuddin Abdullah, in a statement yesterday, said the tender evaluation from eligible service provider licensees began as soon as applications closed yesterday. Commenting further in a statement released, Datuk Saifuddin said the satellite broadband access is a part of the government's efforts to achieve development towards the country's digital transformation through the National Digital Network Plan, Jendela, and the My Digital Initiative, which are core plans to realize the aspirations of a digital nation in line with the Shared Prosperity Vision 2030. He said the area consisted of 178 Orang Asli settlements in Kelantan, Pahang, Perak, Johor, Negeri Sembilan and Selangor, 138 places in the interiors of Sabah and 523 locations in the interiors of Sarawak. According to the minister, the areas are located far from the existing telecommunication network facilities and some of them are difficult to be accessed by heavy machinery due to difficult terrain. He also said that in this regard, the implementation of Jendela was very important to bridge the digital divide so that no one will be left behind when it comes to development plans and also to enable every citizen to be involved in the digital economy. He added that with comprehensive and quality internet access, all Malaysians can enhance their digital skills and enjoy the benefits of digital transformation towards the Industrial Revolution 4.0. Having taken the bold step of fielding an all-local lineup in this season's Super League, Petaling Jaya FC are embarking on another initiative to groom more local footballers through their Jago RF program. PJ City FC President Datuk Sri Subhan Kamal said that through collaborations with the Rhythm Foundation, My Skills Foundation and My PJ, a Petaling Jaya-based community group, the club would scout for talented teenage players aged 13 to 14 from low-income families to excel in the sport. Elaborating further, Datuk Sri Subhan said football is not only about skills but encompasses coaching and grooming the child to be a better person. Meanwhile, national football legend Datuk Santok Singh, who was also present at the signing ceremony, told the media that the initiative would help the boys to gradually progress in life and become successful because football requires discipline. The former national defender also offered his services to coach the teenagers. Rhythm Foundation chairperson Datin Sri Umayal Iswaran said the 3-year Jago RF program would kick off this month through the scouting of 40 boys from B40 families in Selangor and Kuala Lumpur. She added that changes and modifications would be made along the way since this was their first such initiative. And that's it from us this afternoon. In our top story today, over 400 health workers to be sent to Sarawak next week. News at 10 comes on this evening on My Free Views, Berita RTM news channel. I'm Mohana Priya. Thanks for watching and have a great weekend.